Hi, my name is Sifat Naseem from Michigan Technological University. This is my project titled as Advancing Health Literacy Through Generative AI, the utilization of open source large language models for text simplification and readability improvement. This project was done in relation to my thesis for my master's degree. In the digital era where there are vast amounts of diverse information available globally, it is important to ensure information is easily readable and simple to understand, especially for those with limited health literacy. This brings me to the introduction of my project. What is health literacy? It is the degree to which individuals have the ability to find, understand, and use health information. According to the NAL, 36% of US adults had basic or below basic health literacy. As per National Center for Education Statistics, on average by 2024, 21% of adults in the US will be literate. Additionally, 54% of adults have literacy below a 6th grade level. According to the US Department of Health and Human Services, nearly 9 out of 10 adults struggle with health literacy, which is alarming. So, where is the problem? The problem lies in complex medical terminology. Vocabulary terms used in medicine are frequently complex, and often common terms can have distinct and special meanings when used in the context of healthcare. As a result, people with limited literacy often misunderstand or have trouble understanding medical and health related terms, which leads to different consequences, such as unnecessary panic and hospital readmissions, mismanagement of disease, and of course, costs associated with it. Between July December 2022, approximately 58.5% of adults utilized the internet to look for health or medical information. As we are moving towards a healthcare digitization, it may pose a challenge to people with limited literacy. As per National Institute of Health, health material should ideally be at a 6th grade reading level. Yet many online resources don't meet this standard. Patients are considered important stakeholders in healthcare and decision making, so it is important to involve them actively in their care process. Patient engagement can lead to better outcomes and satisfaction. It can boost provider productivity and can lower hospital readmissions by as much as 14%. Accessibility to the healthcare system is an important aspect of better healthcare outcome. According to 2022 survey, it now takes an average of 26 days to schedule a new patient physician appointment. Most of the time, people living in remote areas do not have physical access to better healthcare services because clinicians at primary care hospitals don't have specific domain expertise. So, it is important to increase the accessibility of better healthcare services. From the patient's perspective, customization of care has always played a crucial role in delivering high quality services. So, lack of customization can result in suboptimal outcomes and reduce patient satisfaction, which will ultimately lead to inefficiency in healthcare delivery. So, what is the need? The need lies in simplified health text for literacy, ensure understanding of health information, provide accuracy, authenticity of health tools, improve patient engagement to enhance health outcomes. To address the needs, we have to provide text simplification according to reading rate scale, training a large language models on validated data containing a variety of expertise in the medical field, a user-friendly mobile health application with a chatbot feature to provide consistent access to health information. Now, some background information about text simplification. It is a process of transforming a text into an equivalent which is more understandable. It's characterized by a simple and direct style, smaller vocabulary, and a simpler sentences, thus facilitating access of understandable information to people with a low literacy level. Different reading gauge scales are used to measure the simplification score of the text, such as Flesch Kincaid level, Gunning Fog Index, Smoke Index, Coleman Lee Index. But in our project, we mainly focused on Flesch Kincaid grade level because it's the most common scale used in the healthcare sector. It's easy to apply and does not need sophisticated software for application. Now, some information about the large language model. They play a crucial role in improving the productivity and efficiency of different sectors. They utilize deep learning algorithms and are trained on vast text data. They are crucial for processing natural language and can perform diverse language tasks like translation, sentiment analysis, and chatbot conversations. Here are some of the examples of large language models which are being used commonly. Now, information about the Llama 2. It's an open source family of pre-trained and fine-tuned large language model released from Meta. It comes in different models like 7B, 13B, 70B, where B represents the billions of parameters it's being trained on. It uses reinforcement learning from human feedback and have achieved comparable performance to ChatGPT in terms of helpfulness and safety. Recently, Llama 3 was released by Meta to the public on April 19 and could not be tested prior to the conclusion of this project. Llama 2 does have some limitations like high computational cost, modern hardware, and substantial resources are required for the model's enormous neural network design. Despite the limitations, Llama 2 was chosen for this project because it's an open source model and have extensive neural network architecture trained on billions of parameters holding a great potential for processing and generating meaningful text. Llama 2's design allow for fine-tuning on desired tasks. This means it can be adapted and optimized for specific tasks through supplemental training on custom dataset. Llama 2 provides flexibility in terms of model configuration and hyperparameters, allowing it to modify it to the desired task. A lot of research has been done related to the text simplification, like deep learning technique have been used to simplify text to match a reader's level with a reinforcement learning loop that contains a readability classifier. Zero and few shot learning ability of the LLM has been tested, and results show that LLMs outperform state of the art sentence simplification methods and are judged to be on par with human annotators. Open and closed source instruction tuned large language models have been tested and investigated their performance in writing story completion and simplifying narratives using standard guided prompts controlling text readability. After doing literature review, we were able to find some of the research gaps related to the text simplification. Like limited research has been done utilizing open source for text simplification tasks. To the best of my knowledge, no research has been undertaken regarding the simplification of text based on readers' grade level using Llama 213B or 70B chat model. Prompt engineering is being used for doing task simplification on large language models, but it has been seen that controlling for the readability level, regardless of how informative the prompt is, proves to be challenging for all instruction tuned models. There is need to specify necessary information about the target audience's reading level and the type of assessment used along with the formula when prompting models to minimize the generation of overly complex text. Llama 2 encounters challenges in employing an appropriate readability formula for the computation of reading grade levels. Both Llama 2 and ChatGPT faces challenges in arithmetic calculations, so calculating the reading grade level of a reader is hard for such a model. The aim of our research is assessing large language models like ChatGPT and Llama 2 for text simplification tasks based on reading grade levels, utilizing instruction tuning to enhance large language models' ability in simplifying text to specific reading grade levels, evaluating the effectiveness of training LLMs to accurately determine reading grade scales, investigating the potential of training LLMs to perform calculations relevant to reading grade scale with NLTK libraries, simplifying text content to match specific reading grade levels, ensuring accessibility and comprehension for diverse audience. Now moving towards the methodology. The models we used were ChatGPT 3.5, pre-trained Llama 2 7B and 13B chat model. So ChatGPT 3.5 was used to develop a custom dataset which contains different forms of questions related to the flesh skin cat grade scale with a single answer to correspond to all questions. For complex terminology, data from the living word vocabulary was used, which contains more than 43,000 words along with their respective simple meanings. A percentage score was provided for those words or terms familiar to students in grade level from 4 to 14. And for evaluation, we use the Flash Kincaid grade scale from ddable.com. Now, the first step involves the model evaluation. For the evaluation of the model's ability to produce comprehensible text, we established a use case involving 5 questionnaires related to the mental health of a young child. Models such as ChatGPT 3.5 and Llama 2 7B 13B chat were evaluated with consistent medical health questions between the three models to generate respective responses from the LLMs. Then we assess these responses for their level of simplification using various reading grade scales such as Flesch-Kincaid grade scale, Gunning Fog Index, and smoke analysis from readable.com. Next step involves the instruction tuning. In this step, we perform the instruction tuning by modifying the instructions along with input query given to the models to evaluate the text simplification task. The initial set of instructions include asking for responses from the models to the given query, and the generated response is evaluated using Flesch-Kincaid grade scale from readable.com. We modified the instructions by adding a statement to give the simplified response followed by an evaluation of a generated response. So in the next step, we added the reading grade level to the instruction and evaluation was completed. The last step included the specification of reading grade level and name of the grade scale along with the formula. Then the evaluation was performed. This step involves the verification of reading grade level formula used by the model to calculate the reading grade level of the text. The same input text is passed to all the models with instructions mentioning the reading grade scale name and generated output grade scale was evaluated. For a model to use the correct reading grade formula, we did the fine tuning of the pre trained Llama 27B chat using a custom dataset. So, after loading the model and doing data pre processing, supervised fine tuning trainer was used, which is a technique used for fine tuning pre trained models like Llama 2 with limited dataset on supervised learning tasks. The SIFT trainer uses a parameter efficient method called PEFT and packing optimization to limit the use of memory during the training process, and thus helps with more efficient training of models for improved results through smaller data set. For prompting, an instruction template was defined and prompts were generated using instructions, questions, and answers. The model training was performed with different parameters. We recorded the training loss and observed different epochs ranging from 2 to 10. Then the fine tuned model was saved. After that, we did merging of fine tuned and base model to achieve the robustness of the model. In the next step, we did a simplified response generation as per user's grade level or lesser. Since the prompt engineering and instruction tuning holds a great promise to generate simplified text, it is important to calculate the reading grade level of the user to generate a response from the model suitable for that user. So, in this step, we created a calculator function to quantify the reading grade level of input text as per the Flesch-Kincaid grade scale. For text processing and counting the number of syllables, we use NLTK library along with the CMU pronouncing dictionary, which is a Carnegie Mellon University pronouncing dictionary, and it's an open source dictionary used for speech recognition. Then we use the merge model to generate the response as per the user's reading grade level, as it allows to leverage the wide range of knowledge of the base model along with the specific knowledge gained during the fine tuning. For the evaluation of both input text and generated text, the readable.com assessment was used. The Flesch-Kincaid grade scale considers the words, sentences, and syllables, but it does not consider the complexity or difficulty of words. So, in this step, we did the evaluation of large language models such as ChatGPT 3.5 and Llama 27B Chat to check the word complexity of their response. In this process, an input question related to medical health was passed to the model, and the generated output was evaluated using data from the living word vocabulary, which contains a word list along with their simple meanings and a percentage score of those words familiar to students in a grade level from 4 to 16. Then we compared the words generated by the model with the data list and a score was assigned to it. Now, moving to the results and observations. For the model evaluation, all the models generate responses of higher reading grade level than the recommended 6th grade level, where ChatGPT 3.5 performed worse than Llama 213B in appropriate text output. Llama 213B performed worse than Llama 27B in appropriate text output. For the instruction tuning, it improves the text simplification. ChatGPT 3.5 excelled in generating simplified text responses but struggled to reach the target grade level. Pre-trained Llama 2 7B and 13B showed promising performance in text simplification tasks. However, performance declined with introduction of reading grade scale formula in instruction. For the formula verification, each pre-trained model gave a different score of reading grade level for the same piece of text. Llama 2 does not use the correct formula for calculating the Flesch-Kincaid reading grade level. This shows the actual formula of Flesch-Kincaid grade level and the formula used by the Llama 2 7B chat model, which is of course not correct. For fine tuning using custom data set, we tried different epochs. We started with the 2 and went up to the 10, but the best performance was observed when setting epoch at 8 with a batch size of 4. Then we were able to see decrease in training loss and better convergence. Fine tuning the pre-trained Llama 2 7B chat model with a custom dataset, the merge model was able to generate the correct Flesch Kincaid grade formula. For simplified response generation as per user's grade level or lower, Flesch Kincaid grade level generated by the calculator model for a given input text was the same as that of readable.com. Including the grade level, we were able to generate a simplified response which was lower than the input reading grade level. For example, in this use case, Flesch Kincaid reading grade level of the generated text by our Llama 27B developed merge model was 5.3 as per readable.com, whereas the Flesch Kincaid grade level of the response for the same input generated by the Llama 27B chat demo model without specifying the grade level of the user was 14.8. This demonstrates the accuracy of our developed merge model. After doing the evaluation of models' response to complex words, we can see that ChatGPT 3.4 generates a different complex words, and also the Llama 27B it also generates the complex words. Both the ChatGPT 3.5 and Llama 2 7B chat generated a response containing words with a reading grade level above the recommended 6th grade level. Replacement of complex words with their simple meaning from the living word vocabulary dataset with a grade level of 6 or below can help in making the text simple to understand for the one with low literacy. So, all in all, this research offers insightful information about how to ensure the better accessibility and simplicity of text generated by large language models related to health information to ensure it is understood by people with limited literacy, presenting both current solutions and future directions for advancing text simplification methodologies. There is a great potential in fine tuning the different versions of Llama 2 and Llama 3 models with the larger data sets. If we talk about the future work, and we can train a merge model with a domain specific or medical expertise reviewed data set using a data set from the living word vocabulary to develop a model that replaces the complex words with higher grade levels with their simpler meanings. Additionally, the model holds a great potential for non native English speakers, offering simplified meaning to aid understanding of complex English words. This will be the conclusion of this presentation. Thank you so much for listening.